Good morning. My name is Jackie Ramtran, and I will be beginning my presentation on conflict prevention and resolution in the workplace. I'll begin with a definition of conflict in the workplace, which is, and this is a quote, work conflict is a dynamic process that occurs between interdependent parties in which negative emotions are reflected when the two parties' perceived disagreement and the realization of the goals are blocked. Therefore, work conflict will happen when interacting individuals are inconsistent with their needs, interests, goals, and opinions, or they're temporarily unable to coordinate, resulting in emotional and behavioral hostility and tension with each other. So some examples of conflict, they can be categorized into either communication issues, discrepancies in the management approaches, ethical disputes, interdisciplinary disagreements, resource conflicts, or role conflicts. So some specific examples of these include a conflict may exist between the advanced practice registered nurse and the physician, and they may have a disagreement regarding the patient's plan of care, which can cause strife and tension between these two individuals. Or there may be communication issues which lead to a lack of pertinent information, or even wrong information may be conveyed from, let's say, the front desk staff regarding a patient condition or a patient request. Also, resources can be an example of conflict. Resources can cause conflict when the office is on short supply and perhaps the budget is not allocated to cover buying a surplus amount ahead of time. This can cause disgruntled employees when they don't have what they need available when they need it. Another example is staff may also become disheartened and upset regarding shift preferences or their assigned workload, claiming that it may be preferential to some people. So what are the effects of conflict in the workplace? So studies have outlined the following as the effect of workplace conflict, which includes increased frustration, disruption in the relationship among coworkers, inappropriate communication, growing hostility, and there is a high risk of a spiral effect of violence and interpersonal conflict, and of course, high turnover rates. So in the professional environment, conflict can also lead to decreased productivity, an increased number of employee callouts, high staff turnover, low morale in the office, and mental health concerns. It could also affect the individual beyond the workplace and can matriculate into their personal life. This can be seen as low self-esteem, low self-concept, depression, an increased amount of stress, and burnout. Discuss the ineffective or dysfunctional response to conflict. So the umbrella terms for these would be avoidance, defensive behavior, blaming others, refusing to compromise, becoming emotional, or a lack of action. So avoidance. Avoiding a conflict in the workplace can lead to built up frustration long term and can also cause the issue at hand to grow. A lack of action can also have detrimental effects on the practice if it involves work or supply issues. Defensive behavior. Becoming overly defensive when addressing a situation only exacerbates the situation. This is also a sign of that individual refusing to take accountability for the situation at hand. Blaming others. When you're blaming another or multiple individuals in the workplace for the problem, this only creates a more toxic workplace environment. It also doesn't allow for an unbiased investigation to take place where the situation at hand could be looked into at a deeper level. Refusal to compromise. In some situations, a compromise is necessary to mitigate the conflict. However, if the involved personnel are unwilling to compromise, feelings of animosity may develop, and this equates to an unwillingness to see the other person's side. This is also more dysfunctional when it's management or leadership at hand that has a refusal to compromise, just because they are stuck in their ways that how the office is being run is superior to what another person may suggest. So, a refusal to compromise is definitely a very ineffective response to conflict in the workplace. Becoming emotional. So, in any situation, it's always important to remain calm, especially in healthcare, in primary care setting, critical care. It's important to remain calm and not be emotional. When someone becomes explosive, angry, or hurtful, it can cause a lot of resentment, and it may also cause the other person to react in the same manner. So, and a lot of times, if someone gets to this point and they're trying to express themselves and it's very like explosive and angry, one, their message is not being conveyed the way it should. And then two, the other person may respond in the same manner and have a very defensive, angry reaction towards them expressing themselves. So all of these are very ineffective and dysfunctional responses to conflict in the workplace. So on the other note, what are effective ways in managing conflict? So this includes open communication, mediating, identifying underlying issues, of course, encouraging empathy, seeking a compromise, provide guidance, encourage professional behavior, follow established policies, and document the issues so you're able to follow up. So, starting off with open communication. This allows the staff to express themselves openly and not have a fear of repercussion. So this is your open door policy, and it creates a welcoming environment for employees to feel like they are going to be heard, without a negative consequence. Mediate. Mediating any heated disagreements is important to prevent escalation. So if the situation arises where you even may feel like you need an unbiased person, an unbiased party in the room, just to mediate the situation, then let that be done just so things don't get into a worse place. Identify underlying issues. When employees express unhappiness with a certain situation, it's important to get to the root of the issue and not just address it at surface level. So they say anger is an iceberg emotion, right? So it's important that you're getting down on a deeper level and ask those probing questions to find out really what the issue is at hand. So in 2 weeks or a couple weeks down the road, this same employee isn't running into the same issue and still having that resentment. Encourage empathy. So it's always important to provide empathy and relate to the staff. So it's important to be empathetic and genuinely get a feel for where that person is coming from, because then you can get to a genuine solution that's going to appease that person and even make a situation be more effective or process more effective in the office. Seeking compromise. So compromise is necessary to make the parties involved attain peace while maintaining patient safety and prioritizing what's best for the practice. So processes may be in place, but someone may, find, hey, like this may work a bit better. So everyone should be open to a compromise and just doing what's best for the patients at hand, and of course, prioritizing their safety and the quality of the healthcare being delivered to them. Provide guidance. So providing knowledge to staff members may be useful in certain processes that they don't understand. So regardless, leadership and management should be able to provide guidance to their employees. In some situations, there just may be a lack of knowledge and they may need guidance just like how something needs to be done. So that's always important. It's an effective way to manage conflict by providing knowledge and filling in a knowledge gap. Encourage professional behavior. So first and foremost, all staff should always remain professional in handling a conflict. This ties into one of the dysfunctional responses to conflict, which is avoiding being emotional. So it's important to express your emotions and how you're feeling in a professional manner and go about things professionally and go up the chain of command and report things accordingly in an appropriate way. Follow established policies. So always refer to the practice or the organization's policies and procedures. So these policies are policies for a reason. They have been tested and true to prove that patient safety is the priority, and they they are there to make a smoother process for patients as well as the healthcare workers. So document the issue and follow up on it. So having a paper trail of the issue keeps everyone accountable. And this is also a great way to ensure that the problem doesn't relapse. So this is a great way for management or whoever's handling the situation to say, hey, this happened on this day. This was the resolution. Let's follow up on the employees involved, or let's follow up on this process. So that's always a great way to manage the conflict and make sure it does not recur. Okay, what are the effective ways in preventing conflict? So there was a proposal of organization citizenship behavior, which is a method that was used to prevent conflict in the workplace. So this includes altruism, conscientiousness, sportsmanship, courtesy, and civic virtue. So starting with altruism, this is an attribute which describes the extent of willingness that employees exhibit when helping their coworkers with tasks. So this is being, human nature, having altruistic behavior, just doing something out of the goodness of your heart for the overall good of the practice and the overall benefit of the patients, not looking for something in return, just you doing something to help the practice. Conscientiousness refers to when employees go above and beyond their designated duties to work diligently, exhibit excellent attendance, punctuality, and they're not taking advantage of company time by taking extended breaks or saying they're going on break but don't go on lunch for 20 minutes after that. So ultimately they're gone for like an hour. So that's just being conscious of what you're doing on company time and how your behavior affects others. Sportsmanship. This is when employees are team players. They can overlook trivial and temporary deficiencies or issues done by staff members. So this is, like the phrase goes, taking one for the team. If someone, is lacking on their duties and you want to bear resentment towards them because then you have to pick up their slack. This is just kind of overlooking that and just having the bigger picture at hand and knowing that picking up their slack or helping them out is going to be beneficial for everyone overall. Courtesy. This is when an employee performs thoughtful gestures towards their coworkers and prevents creating problems in the workplace. Just extending courtesy to others, asking if someone may need help with something. Something as small as that is just showing friendly demeanor and a willingness to help. Civic virtue. This is an attribute that entails constructive involvement and interest in the activities of the workplace. They participate in meetings, express their opinions on policy change, and they have the organization's best interest at heart. So all of these things, when employees embody this, healthcare providers and staff alike, these are effective ways in preventing conflict and just maintaining a healthy practice environment overall. And then lastly, the case study, I chose to propose a case study regarding conflict on roles and responsibilities. So the proposed case study of conflict in a primary care office pertains to roles and responsibilities. When a position in the office does not have clearly defined duties, this can lead to a wide variety of negative consequences. Some of these consequences include tasks being left undone or delayed, disgruntled workers, and ultimately unhappy patients. A clear example of this is medical paperwork, such as back to school forms, work documents, FMLA papers, just to name a few. So after seeing their provider, it is the expectation of the patient that their paperwork be handled diligently. However, these documents can be passed from hand to hand of the adjunct staff and can potentially slip through the cracks. Needless to say, the practice will ultimately suffer and also earn a reputation of inefficiency and disorganization. Undefined role responsibility in this scenario specifically can lead to the medical assistants passing the forms to the front desk with the assumption that they handle admin work, or the front desk assuming that the forms require medical information, so the medical assistants should be completing the forms, or this can even trickle into the healthcare provider's assumed responsibility. So this situation can be resolved by clearly delineating what each staff member is required to do. A meeting should be held to outline the process of handling such paperwork efficiently. The resolution includes the healthcare provider should fill in the applicable medical information such as diagnoses codes or whatever the patient requires them to fill out, and providing their signature whilst in the room with the patient. And then the front desk should be responsible for completing the rest of the paperwork, whether it's filling in the office information, address, phone number, contact information, and then scanning into the patient's chart and handing it back to the patient. So eliminating the medical assistant as a middleman reduces the risk of paperwork being missed or lost. This also deters staff from resenting coworkers by assuming that they're doing extra work or they're doing something that's not listed in their job description. So this case study was a great example of just reducing conflict in the workplace by clearly defining what each person is responsible for, so there's no unmet expectations. And that concludes my presentation on conflict prevention and resolutions in the workplace. Thank you very much.